From my years in clinical medicine, I have noticed something consistent. Very few people think seriously about their liver, certainly not compared to their heart or kidneys, and I find that genuinely concerning. Because when you work in medicine, you start to realize that the liver tells you more about someone's overall health than almost any other organ. Your liver markers are almost always correlated with how well or how poorly someone is doing, long before they feel seriously unwell, long before anything shows up dramatically. The liver has already started giving subtle hints. The difference is that the liver operates quietly in the background, doing hundreds of jobs simultaneously, and it does not send obvious distress signals in the early stages. By the time people notice something is wrong, significant damage has often already set in. Today I want to talk about early dysfunction, the kind that is often completely reversible if you catch it in time. The kind that is tied directly to metabolic health and fatty liver disease, now the most common liver condition in the world. My name is Dr. Victor Hayes. Let me walk you through 7 early warning signs and explain exactly what is happening in your liver when each one appears. First, let me briefly explain why the liver is so central to everything else, because understanding its role makes these signs far more meaningful. Your liver filters every drop of blood leaving your intestines before it goes anywhere else in your body. It regulates glucose, deciding how much sugar gets stored and how much gets released into circulation. It processes dietary fats and produces bile for fat digestion. It manufactures clotting factors that prevent excessive bleeding. It neutralizes toxins, medications, and metabolic waste products. It is running all of these functions simultaneously, continuously, every day. When fat begins to accumulate inside liver cells, the earliest stage of metabolic liver disease, all of those systems start to become less efficient. Not dramatically at first, subtly. And that is exactly why these 7 signs matter so much. Warning sign number 1 is a specific kind of fatigue. I know fatigue is an extremely nonspecific symptom with dozens of possible causes, but liver-related fatigue has a particular quality that is worth understanding. One of the liver's central roles is managing your glycogen stores, your body's short-term energy reserve, and releasing glucose into the bloodstream when your blood sugar drops. When fat accumulates in liver cells, it disrupts the insulin signaling that controls this process. The liver develops hepatic insulin resistance. It stops responding properly to insulin instructions. Blood sugar regulation becomes erratic. Instead of steady, reliable energy throughout the day, you get peaks and troughs. On top of this, early liver dysfunction generates low-grade systemic inflammation. Your immune system is running slightly activated all the time, quietly consuming resources. The resulting fatigue is not the satisfying tiredness after a productive day or a hard workout. It is a background exhaustion that does not improve with sleep. A sense of running at reduced capacity, even on days when nothing particularly demanding has happened. People often describe it as feeling like they are operating at 50% without understanding why. That mismatch, tired without a clear reason, is a detail worth paying attention to rather than normalizing. Warning sign number 2 is an expanding waistline. An expanding waistline is not just about subcutaneous fat, the soft fat you can pinch under your skin. The clinically significant fat accumulates viscerally, deep in the abdomen around your organs, and visceral fat and liver fat are not simply sitting near each other, they are actively driving each other. Visceral fat releases fatty acids directly into the portal circulation, which drains straight into the liver. This is essentially a constant drip of fat directly into liver tissue, accelerating the progression of fatty liver disease. Research consistently shows that waist circumference is one of the strongest predictors of liver fat accumulation, even in people who do not appear obviously overweight. You can have a normal body weight on the scale and still carry enough visceral fat and liver fat to put you at significant metabolic risk. The measurement that matters is your waist-to-height ratio. Your waist circumference in centimeters should be less than half your height in centimeters. If you are 180 centimeters tall, your waist should ideally be below 90 centimeters. These numbers reflect the point at which visceral fat accumulation begins affecting organ function. Warning sign number 3 is mildly raised liver enzymes on a routine blood test, particularly ALT and GGT. Most people, when told their results are slightly outside the normal range, do not give it much thought. Their doctor may not either. But mild elevations in these markers, even within what some labs still classify as borderline, can be meaningful early signals. ALT, alanine aminotransferase, is the most liver-specific of these enzymes. It lives inside liver cells and only appears in elevated concentrations in your blood when those cells are being damaged or stressed. A persistently elevated ALT, even at levels that some guidelines classify as borderline, is often the earliest biochemical sign of fatty liver disease. GGT, gamma-glutamyl transferase, is particularly sensitive to both alcohol and oxidative stress inside liver tissue. It rises early when the liver is under metabolic strain. The problem is that because these elevations are modest, they are easy to dismiss. If you have had a blood test showing these results flagged, even mildly, do not ignore it. Get it rechecked. Ask about liver imaging if you have reason to believe you may have metabolic risk factors. This is where early intervention is most powerful, because at this stage, the damage is still highly reversible. Warning sign number 4 is a vague sense of fullness, pressure, or a dull ache in the upper right abdomen. Your liver sits under your right rib cage, covered by a fibrous capsule. With fatty liver disease, fat accumulation enlarges the liver tissue, and as the organ expands, it stretches that capsule. The capsule contains pain receptors, and when placed under stretch, it produces a dull, non-specific discomfort. This is nothing like the sharp pain of a kidney stone or appendicitis. It is easy to mistake for digestive bloating, a pulled muscle, or general abdominal discomfort, particularly since we all experience occasional abdominal symptoms. Many people live with this sensation for months without connecting it to the liver. The distinguishing features are that it is persistent, localized specifically to the upper right area beneath the ribcage, and associated with other signs from this list. In that context, it becomes something that deserves investigation. Warning sign number 5 is worsening blood sugar control. The liver is arguably the most important organ in glucose regulation, and this connection is direct. The liver acts as your body's glucose buffer, absorbing excess sugar from the bloodstream after meals and releasing it back when levels fall. When fat infiltrates liver cells, that regulation breaks down. The liver develops resistance to insulin, meaning it continues releasing glucose into the bloodstream even when blood sugar levels are already elevated. This is called inappropriate hepatic glucose output. The downstream effect is that blood sugar runs chronically higher. You may notice your HbA1c gradually creeping up on annual blood tests. You may feel more tired after meals or notice stronger cravings for carbohydrates as your body tries to compensate for the energy instability. You may feel that your blood sugar is less predictable than it used to be. This is the metabolic trajectory toward type 2 diabetes, and the liver is frequently where that trajectory begins. Early fatty liver disease and early insulin resistance are not separate problems. They are the same problem manifesting in different organs simultaneously. Warning sign number 6 is changes in appetite, specifically feeling full very quickly or having reduced interest in eating, particularly in the morning. Low-grade liver inflammation interferes with the normal hormonal signals regulating hunger and satiety. An enlarged liver can also physically compress the stomach, creating a genuine mechanical reason for early fullness. The result is that meals that used to feel normal now feel overwhelming after just a few bites. The appetite for breakfast, or for food first thing in the day, diminishes gradually. This is not the same as choosing to fast in the mornings. It is a shift in your baseline appetite that happens slowly and tends to be noticed more clearly in retrospect, when you realize you have been eating considerably less than usual without intending to. Warning sign number 7 is nausea or digestive discomfort after fatty or rich meals. Your liver produces bile, which is stored in the gallbladder and used to break down dietary fat. When the liver is not functioning efficiently, bile production and flow become sluggish. Fatty or rich meals do not get processed properly, and what follows is that familiar post-meal heaviness, bloating, nausea, a sense of feeling off for a couple of hours after eating. Most people assume they have developed a sensitive stomach, or that they just do not tolerate certain foods well anymore. Sometimes that is genuinely all it is, but when this pattern keeps occurring alongside the other signs I have described, the fatigue, the expanding waistline, the mildly elevated liver enzymes, it fits into a clear metabolic picture that deserves medical attention. I want to close with something practical, because I know that recognizing symptoms and not knowing what to do next is frustrating. If any of these 7 signs have resonated with you, the appropriate next step is a blood test. Ask your doctor specifically for liver enzyme tests, ALT and GGT, alongside fasting glucose and a lipid panel. If you have reason to believe your liver health may be compromised, ask about a liver ultrasound. The wider point is this: do not attribute vague symptoms simply to getting older, particularly if you are not actually that old. Fatigue without a clear cause, an expanding waistline, mildly elevated liver markers, blood sugar that seems less stable than it used to be. These are signals worth investigating, not normalizing. And here is the genuinely encouraging news about all of this. Unlike most organs, the liver has a remarkable capacity to recover, particularly at this early stage before serious damage has set in. Studies consistently show that losing just 5 to 10% of body weight produces measurable reductions in liver fat and in many cases completely normalizes liver enzyme levels. It is not a dramatic amount of weight. It is achievable for most people. The interventions with the strongest evidence are not complicated: reducing ultra-processed food, minimizing alcohol, improving sleep quality, and increasing dietary fiber to feed the gut bacteria that reduce liver inflammation. These changes work. They work because you are directly addressing the causes rather than the consequences. Your liver is quietly sending you information right now. That information is something you can act on. And the earlier you act, the better the outcome. Please subscribe to this channel and share this with someone who needs to hear it. I will see you in the next video.